It's a 2cc drip. You want to increase that?
Sure, yes, make it 4.
Miss Baring, this is Jason Posner. He's going to do your medical history and ask you a few questions. He's Dr. Kalikian's fellow.
Professor Baring, I'm Dr. Posner, clinical fellow at the medical oncology branch, working with Dr. Kalikian. Sit over here, please. Professor Baring, I was a student at the university. I took your course in 17th century poetry.
Did you?
Yes, I thought it was excellent.
Well, thank you. Were you an English major?
No, biochemistry. But you can't get into med school unless you're well-rounded. And I made a bet with myself that I could get an A in the 3 hardest courses on campus.
How'd you do, Jace?
Success.
Really?
A minus. It was a very tough course. Yeah, I'll call you.
Okay.
Just wheel this over. Okay, now, I'm going to be taking your history, which is a medical interview, and then I give you an exam.
I believe Dr. Kalikian has already done that.
Well, I know, but Dr. Kalikian wanted me to do one, too.
Very well.
Okay, let's just get started. How are you feeling today?
Fine, thank you.
Excellent. And how's your general health?
Fine.
Good. Now, we know that you're an academic.
Yes, we've established that.
So we don't need to talk about your interesting work.
No.
How old are you?
48.
Are you married?
No.
Are your parents living?
No.
How and when did they die?
My father, suddenly, of a heart attack when I was 21. My mother, slowly, when I was 41 and 42, of cancer, breast cancer.
Cancer?
Yeah, breast cancer.
I see. Any siblings?
No.
Now I'm going to ask you about your past medical history. Have you ever been hospitalized?
Yes, I had my tonsils out when I was 8.
Have you ever been pregnant?
No.
Heart murmurs?
No.
High blood pressure?
No.
Venereal diseases? Uterine infections?
No.
Thyroid, diabetes, cancer?
No, well, cancer, yes.
Well, when?
Now.
Well, not including now.
In that case, no.
Okay. Clinical depression, nervous breakdowns, suicide attempts?
No.
Do you smoke?
No.
Ethanol?
I beg your pardon.
Alcohol?
Oh, ethanol. Yes, I drink wine.
How much? How often?
A glass with dinner occasionally, and perhaps scotch every now and then.
Do you use any substances?
Such as?
Marijuana, cocaine, crack cocaine, PCP, ecstasy, poppers?
No.
Do you drink caffeinated beverages?
Oh, yes.
Which ones?
Coffee, a few cups a day.
Okay. How many?
2 to 6. But I really don't think that's immoderate.
How often do you undergo routine medical checkups?
Well, not as often as I should probably, but I've felt fine. I really have.
So the answer is?
Every 3 to 5 years.
What do you do for exercise?
Pace.
Are you having sexual relations?
Not at the moment.
Are you pre or postmenopausal?
Post.
When did your period stop?
About 2 years ago.
Okay. When did you first notice your present complaint?
This time now.
Yes.
Oh, well, about 4 months ago, I felt a pain in my stomach, in my abdomen, like a cramp, but not the same.
How did it feel?
Like a cramp.
But not the same.
Duller and stronger. I can't describe it.
What happened next?
Well, I don't know. I started noticing my body, little things. I would be teaching and feel a sharp pain.
What kind of pain?
Sharp. And sudden. Then it would go away. Or I would be tired, exhausted. I was working on a major project, the article on John Donne for the Oxford Encyclopedia of English Literature. It was a great honour, but I had a very strict deadline.
So would you say you were under stress?
It wasn't so much more stress than usual. I just couldn't withstand it this time. I don't know. So I went to see Dr. Chin, my gynaecologist, after I'd turned in the article, and explained all this. She examined me and sent me to Jefferson, the internist, who sent me to Kalikian because he thought I might have a tumour.
And that's it?
Till now.
That's very interesting. Well, I guess we'll start the exam. Why don't you just sort of lie back and relax. Won't take a minute. let me get the sheet here. Okay. Okay. Oh yeah. Just feet in the stirrups here. Okay. Okay. Could you just, yeah. Yeah. There. Okay. Good. Okay. Okay. Oh, I've got to go get Susie. I got to have a girl here, some crazy clinical rule. Don't move, I'll be right back. Susie?
I wish I had given him an A.
Susie?
2 times 1 is 2. 2 times 2 times 3 is 6. Death be not proud, though some have called thee mighty and dreadful, for thou art not so. For those whom thou think'st thou dost overthrow die not, poor death, nor yet canst thou kill me.
Has anybody seen Susie?
One short sleep past, we wake eternally, and death shall be no more, comma, death thou shalt die.
Okay, here's everything. Okay.
What is this? Why did you leave her like
I had to
this?
find you now. Come on. We're ready, Professor Baring. Get this on. All right. All right. Just get this up. Ooh, just relax. Okay. Isn't that interesting, Susie, that I had Professor Baring?
Yeah. Yeah, I wish I had taken some literature. I don't know anything about poetry.
Professor Baring was very highly regarded on campus, looked very good on my transcript that I had taken her course. They even asked me about it in my interview to medical school. Jesus.
What?
What?
Yeah, I survived Baring's course, yeah. No problem. Yeah, John Donne, those metaphysical poets, that metaphysical wit. Hardest poetry in the English department. I'd like to see them try biochemistry. Okay. We're almost done. All right. Yeah, okay. That's it. We're done. Okay, I gotta go. Take her feet out of, yeah.
All right. Let's say it's Friday morning. Grand rounds is what they call it. Action!
Dr. Baring?
Dr. Kalikian.
Professor Baring, how are you feeling today?
Fine.
Great, just great. Very late detection, stage just 4 upon admission. Hexamethylphosphosol with vinplatin to potentiate. Hex at 300 milligrams per meter squared, vin at 100. Today is cycle 4, day 3. All cycles are at the full dose. Primary site is here, behind the left ovary. Metastases are suspected in the peritoneal cavity, mainly in this area here. Full lymphatic involvement. At the time of first look surgery, a significant part of the tumor was debulked, mainly in this area here. Left, right ovaries, fallopian tubes, uterus, all out. Evidence of primary site shrinkage. Shrinking in metastases has not been documented. Primary mass, frankly palpable in pelvic exam, all through here.
Excellent command of details. Okay. Problem areas with Exenvin?
First, of course, is myelosuppression and lowering of blood cell counts. That goes without saying. With this combination of agents, nephrotoxicity will be next.
Anybody else? Side effects?
Nausea, vomiting.
Jason?
Routine.
Pain while urinating.
Routine.
Psychological depression?
No way.
Oh, anything else? Other complaints with Hexenvin? Come on.
Mouth sores?
Not yet.
Skin rash.
No.
Why do we waste our time, Dr. Berry?
I do not know, Dr. Kalikian.
Use your eyes. Good grief. Hair loss.
Come on.
Doesn't count.
You can see that.